Welcome to the Cancer Support Suffolk podcast. I'm Mark Murphy. I'm the CEO of Cancer Support Suffolk, supported by the Suffolk Community Foundation and the Suffolk and North East Essex Integrated Care Board. Every month we'll be talking to people who've had a cancer diagnosis and they'll be sharing their personal journeys with us. We'll also be talking to health professionals for all the latest news on the treatment of cancer. This month we're looking at bowel cancer, the signs to look out for and the importance of making sure you respond to any screening opportunity. Well, with me is Julie Steadman, who's lead specialist screening practitioner with ESNEF's bowel screening programme. She works at Ipswich and Colchester hospitals. I'm also joined by Rebecca Scott and Terry Hunt, who are here to share their experiences with bowel cancer. Welcome to the podcast, everybody. It's really great to see you. And we're in the centre of Ipswich here, so if you hear a bus go past or a siren, don't worry about it. Just carry on, because that's what life is like in our hub here in the centre of Ipswich, our beautiful, wonderful old Tudor building, but occasionally we do get a bus or an ambulance going past. So it's great to see you all. Thank you very much for joining us on the show. Julie, if I can start with you, we talk about bowel cancer. People know about bowel cancer, or do they? So when we talk about bowel cancer, what are we actually talking about?
Bowel cancer, to give it its official title, colorectal cancer, is cancer affecting the large bowel, which is the colon, and includes the rectum, which is the very first part of the bowel.
And do you think some people use that as a catch-all phrase then, bowel cancer? It applies to various other parts of the body around there, or could do?
I think people sometimes believe it's anything that's in their abdomen, but there are a lot of other organs there as well. So bowel cancer is the colon and the rectum.
And how common is it?
It is very common, yeah. It's the third most common cancer.
And when people are coming to you, it's traditionally over 50, isn't it? But we'll hear later on that younger people can get it, but it's predominantly people over 50.
Predominantly over 50, yes, and which is why we're bringing the screening age down to 50, which was 60 originally, but we're bringing it down to 50.
Okay, we'll touch on that a little bit later on, the FIT test, as it's called. I want to talk to Terry and Becks as well now, because it's all about hearing someone's journey and experience. And I said, Becks, it is predominantly people over 50, but you were much, much younger than that when you had your diagnosis. When did you first realise something was not quite right?
I knew something wasn't right when I was, before I was probably 37, 38, and had a gradual decline over about 9 months, and then was diagnosed a week after my 39th birthday.
What sort of symptoms did you have? What were you feeling like?
I had feelings of what I could only describe as cystitis initially. And I don't think that was necessarily a connection. It was more a trigger in my body that things weren't quite right. Lethargy, tiredness was very key, running out of breath, doing simple things I had very young children at the time, walking up the stairs. And then I think the big turning point for me was weight loss, which was not correlating to what my experiences of, just general losing weight were after having children and after Christmas and all of those lovely things. In the January, I thought, I'll lose a bit of weight. I've got my best friend's wedding coming up in April, and the weight just dropped very rapidly, and I was very aware of that. But it took until beginning of June, the 12th of June, to actually get the diagnosis of stage 3 bowel cancer, which by that point had spread to lymph nodes, and 5 were severely infected. So I was very fortunate that the lymph nodes did what they needed to do and had stopped that spread going to any key organs just.
What a shock to hear that.
Huge shock. Yeah, huge shock, especially when I was dismissed from quite a lot of GPs when I was presenting with what I knew to be in myself illness. I didn't know what. I never expected bowel cancer at all, but I knew I wasn't well. I knew how I was feeling was very different to my body. And I was fortunate that I was able to trust my gut. I was very stubborn. I kept pushing. I was admitted to hospital in the May with severe anemia because a blood test, which doctors finally agreed to do, showed my blood count was very, very low. Should be about 120 in a female of my age. It had dropped to under 60. I was told I shouldn't be standing still. How was I functioning? And even at that point, with a weekend in hospital, I was discharged with gynecological problems for a female approaching 40.
Is it because of your age that they were suspecting it wasn't bowel cancer?
I believe so. At one point, a doctor even told me, when I kind of pushed for another follow-up before having been admitted to hospital, that although I was presenting with symptoms that mirrored a bowel cancer diagnosis, I couldn't be bowel cancer because I was under 70. And if I was 70, I would be put through for all the relevant checks.
Wow.
But because I wasn't, that wasn't what they were going to do.
What do you make of that, Julie, when you hear that?
Awful to hear, isn't it?
Yeah.
And be dismissed. And you know your own body and know that something's wrong.
I think that's probably one of the most important things I think I share with people now. I'm quite open about talking about it. And I think that's really important because I want other people to know that if they don't feel right in their own bodies, it's not about seeking a cancer diagnosis, but it's about having it ruled out.
Dame Deborah James, Bowel Babe, as she was affectionately known, she's quoted as saying she knew something was wrong with her body. A sort of sixth sense. Is that what you experienced?
Yes, I think so. You know, I'm a mum of two. I'd gone through 2 pregnancies. I'd gone through 2 labours. I was fit, healthy. My weight was always quite good. I didn't necessarily ever have significant ailments. So to suddenly feel so challenged by just basic day-to-day life was a massive, massive warning for me that something wasn't right at all. And it was that sixth sense. And I do, you know, that trusting your gut, knowing your body, knowing those changes, highlighting those changes, diarising those changes, so that when you then go and speak to practitioners who you are putting your trust in, you have those patterns, you can record them, you can push. But it is about saying, no, I don't agree with that. I think I saw 12 different people along my journey, paid to go private with 2 consultations. And it wasn't until after that point I got the diagnosis. And I'm not actually saying that was necessarily because of the private diagnosis itself, but that was the one person that at the time that the consultant found a mass that he could feel. That mass might not have been presentable on the other checks I had. But again, if I hadn't kept pushing, that could not have been found. And I do believe that if I hadn't pushed as hard as I did, I wouldn't be sitting here today.
Terry, what about you? I mean, you are a little older than Becks. 16 years ago, you were diagnosed. What were your symptoms? What was happening to you?
Yeah, well, I was just over 50 then. And I suppose the first thing I noticed was, you know, a change in my bowel habit, a bit more urgency, sometimes getting caught out. So I thought that's not right. And then I dithered a bit, as I think middle-aged men tend to. But then I noticed that there was some blood in my poo and it stayed there. And I went to my GP and was told, you're a 51-year-old man with blood on your poo, must be piles. So left that for probably 3 or 4 weeks. And I thought, no, that's not right. I'm not happy with that diagnosis. I've still got blood in my poo. I've still got an unusual bowel habit for me. So there's a common theme here, isn't there? I got very insistent. I was referred and had a colonoscopy, and they found that I'd got a tumour, and that was operated on about 3 weeks later. And very fortunately, and I think I was fortunate to have quite distinct symptoms, it was a Dukes A. Does that make sense to clinicians? Which I think is...
Julie's nodding away there.
Which is before stage 1. It's not even reached stage 1, I think. Is that right? I don't know. But it was a very early stage tumour that hadn't spread anywhere. The test showed that it was localised. I had an ileostomy, which is similar to a colostomy, but slightly different. And because I'm type 1 diabetic, I heal very slowly. So it was 16 months with a stoma bag, which you get used to. And I now have 3 yearly colonoscopies as surveillance. I've had lots of polyps scraped away, on which you can watch if you really want to. It's not the best TV ever, but
wouldn't be my choice. But
I find it quite fascinating.
Well, yeah. Well, once they've given you the happy juice, you can watch anything, I think. But so 16 years later, I'm here and touch wood, happy and healthy.
What about your treatment then, Becks? What did that entail?
I had a colonoscopy and an endoscopy, and it was the colonoscopy that found the tumour. And then within 3 weeks again, was in for major surgery. I didn't have a colonoscopy bag. I was expected to potentially come out with one, but my surgeon said if I had, that wouldn't be long term. But he was a phenomenal surgeon, and I know I owe my life to him. He managed to do all of the surgery without that. He took out every single lymph node in that area. I didn't realise I had quite so many in the abdominal zone when he told me how many he'd taken out. And he took away a lot of tissue from the stomach and the kidney lining at the time, because he said he wanted to kind of open surgery, clear out everything he possibly could, which I'm forever grateful for. And then after that, they very quickly got me in for chemotherapy, which was a 6-month course of chemotherapy, going in every 2 weeks, receiving tablets that I took at home for 2 weeks, and an infusion that I went into hospital to receive over the course of the day. And I have to say, they were dark times. I wouldn't wish chemotherapy, or potion, as I like to refer to it as. I had 2 very young children, so mummy's magic potion was far better language to use at home than chemotherapy. So that's what I use. It's potion. Yeah, I had potion. And it did what it needed to do, but it was horrific. There's no other, If you think what hell could be like, I think that's where it takes you.
And that's the reality of dealing with something like this, Julie, isn't it? You know, it's you've got to go through this, haven't you? And the advances in technology and treatments now are huge, aren't they?
They are. There's a lot of robotic surgery. Most of the surgery they do at our 2 hospitals is now robotic. So there have been big changes, even in the last few years, in the types of surgery. Things like immunotherapy are coming forward. So lots of changes, lots of progress.
Yeah, well, it seems almost like every week there's some new news about battling cancer. But the early diagnosis is so crucial, isn't it? So crucial. I mean, it's interesting that both Terry and Becks are talking about, echoing what Dame Deborah said, knowing that there's something not right with their body, but not taking the first diagnosis, pushing, knowing that there was something seriously wrong there. And we shouldn't have to do that, but I think we do, don't we, sometimes?
Sometimes just perseverance, isn't it? I think you've both echoed that, really, that you do have to keep going, and you know something's wrong, so you want to do something about it, which is completely fine.
I think listening to, obviously, knowing my own story and hearing yours as well, Terry, Terry's was a very early diagnosis, which was fantastic. Yeah. Still needed surgery, needed the colonoscopy. Mine was quite a late diagnosis, stage 3, that had spread to the lymph nodes. Still had the surgery, didn't come out with the colonoscopy, but I didn't have any symptoms of blood in my poo. And that's one of the things that I think people assume they have to have a cancer diagnosis. I never had that. I had certain changes in bowel movements and going to the toilet and pooing, but I associated that a little bit more with the fact that my periods had shifted, and I think my cycle and my periods had shifted because my body was struggling. And I think as a female, that's a really common thing that can change. Your menstrual cycle goes a bit out of whack because your body's trying to balance everything that's going on with it. But although I had sort of more loose movements, they, again, didn't associate with the bowel cancer, and there certainly wasn't any blood. So I think you have to really be aware that it's not just one symptom. It can be a manner of a number of symptoms. And if you have any of those or none of those and you don't feel right, you have to just keep getting yourself checked and heard.
What sort of things, Julie, should we look out for?
Becks says it's very important that there may be no symptoms at all with bowel cancer, particularly in early stages. But you've mentioned quite a lot of the things to look out for. Change in bowel habit, so that could be going more often, less often, having diarrhoea, being constipated, blood in the poo or in the pan. But again, that can be caused by lots of other things as well, not just by bowel cancers. If you feel tired, you feel not yourself, you can feel a lump in your abdomen, you've got pain of any kind, something's different to normal, and your bowels, you think, this is not how I normally am, then you make sure you get checked out and persevere. Yeah,
and persevere is the key there, isn't it, really? And Terry, how are you now?
Touch wood, Mark, I'm good, yeah. 67, as I say, I have regular surveillance, colonoscopies, and so that's 16 years, which, is a fair old chunk of life, isn't it? And, I think if I'd ignored it and just sort of pressed on and taken the first diagnosis, who knows? Who knows where that... It would have certainly been more complicated than it was. As it turns out, it wasn't exactly a walk in the park, but from my surgeon's point of view, it was very straightforward. I lived for 16 months with a stoma and a bag. But as he would always say, that little thing saved your life. And it did. And it did. Well, he saved my life, really.
And there's much more talk about stomas now, isn't there? It's much more in common parlance now. And there are people who are really kind of out there and showing that it's nothing to be ashamed of at all. It's there. It's helping to save your life, isn't it?
Yeah, and the girls at Ipswich Hospital, the stoma nurses were absolutely fantastic. You know, it's probably not a profession that many people would choose, dealing with people with poo coming through a hole in their stomach, but they do it, and they do it brilliantly, and they do it with a laugh and compassion, and they are fantastic. And, you know.
Well, Julie, tell everybody what you've got on the back of your shirt.
I have on the back of my shirt, to quote the words of Dame Deborah James, check your poo.
Check your poo.
Yeah.
Yes, check your poo. It's emblazoned on your shirt there.
Yes.
And you were telling me before we started recording that sometimes if you're in the queue for some food at the hospital, or if you're going shopping, you forget that's on your back.
Yes, we go out to do our health promotion sessions is when we wear these polo shirts with the words on, and you do tend to think, oh, I've forgotten I've got that.
It's massively important, though, isn't it, to normalise what is normal for all of us. We all poo. You know, it's part of daily routine, daily habits, and being healthy. And Dame Deborah helped to normalise that with her way and her passion for just sharing her story. And I think if we can have these open dialogues in the supermarket, on podcasts, with friends, with families, in workplaces, that makes the difference of saving someone else's life if they can get those early diagnoses.
It's all about education, isn't it, really?
It's about it.
And not being afraid to talk about it.
Massively.
Yeah. And how are you now?
We talk about my pig.
You're welcome anytime. How are you doing? I mean, your treatment was pretty rough. What about the recovery?
Yeah, treatment was very gruelling. I think coming out of all of that, people, again, when you say, I don't like to use the term remission. I kind of feel as though it puts you on a bit of a lead where you're almost expected to not always be in remission. So I like to use the term NED. I'm in NED, no evidence of disease, which is currently where I am today. And that's how I sort of approach each day. I have just been given the kind of all clear of being in NED at the 5-year point. So similarly, I'll have my 3-year colonoscopies. And I think not the hardest part, but I think when you come out and are told you haven't got any evidence of disease, people's automatic response is, oh, that's brilliant, it's amazing news, great, when are you back to work, when does life return to normal? And that's a great celebration for them to have. But for people who have gone through surgery, radiotherapy, chemotherapies, you are way off of being back to your norm. And I now live in a new norm. I poo up to 12 times a morning in the space of a couple of hours. My poos are very loose. I have accidents. So my way of life is very different to pre-cancering, but I'm fortunate that I'm here, and I'm fortunate that I'm pooing up to 12 times of a morning, because I'd rather be doing that than not here. So in that sense, I'm very well from the cancering. And again, I call it cancering because I wanted to not be a noun and the permanent. I wanted to be something that could change and evolve. So for me, I've been through cancering, I've canceringed. So yeah, that element's all good, and day-to-day life is different, but manageable.
Has it changed your attitude to life?
I think it has, yes. Obviously, I was diagnosed when my children, so Florence was 5, William was 3, so they were very young. So as a mum, I think it gave you a different perspective. My mum died of breast cancer when I was 23. So I think I had quite a different outlook on life and the fact that it is very short and can be taken very quickly. I think it reminded me a little bit of maybe things you lose when you're a busy mum and you're a working mum and you're just older and life gets in the way. I think it reminded me a bit of what maybe elements I had lost. But I don't think it changed me that much because I had quite a challenging experience in the cancering world when I was younger, and you only get one life.
What about you, Terry? Did it change your outlook and how you looked after yourself?
To an extent, I suppose, yeah. I mean, I realised how lucky I'd been. I realised how fragile life is, because I think when you're younger, you feel invincible, don't you? And it was a short, sharp shock at 51 that, my children were still relatively young. They were teenagers. So having to tell them was difficult. And, yeah, it was an experience that I wouldn't say I was glad to have by any means. But, you take some positives from it. and move on, and hopefully as a slightly adapted person.
Julie, what can we do to look after ourselves to try and, I mean, some cancer is genetic, isn't it? And, and Lynch syndrome, we're going to have a special podcast all about that in a few months' time. But lifestyle factors do play a big part in this, don't they?
They certainly do in lots of cancers. So all the generic things like smoking, drinking, exercise, obesity, it'll help to not necessarily prevent, but help you along the way.
But also, if you're going through cancer treatment, as Becks has said, it can be grueling, not always, but it can be grueling. So the better you are health-wise, the better the chances you have of dealing with that treatment and bouncing back.
Yeah, that's right. I always tell patients if we diagnose a cancer in our screening patients, I do always say to them, the fitter you are at the start will help you through your treatment and your recovery.
And we have to know what we're putting into our body, don't we? Whether that's cosmetics, lotions, potions, the environment around us. The food we eat is something we can really easily all manage. I spent my days drinking green smoothies through cancering and potion because I thought, well, if I'm putting that extra layer of goodness in, it's got to battle for want of a better word, the poison that was going into it. And it is, if we can take care of ourselves with everything that we have control of, then that puts you in a better position to come out of things maybe.
And Julie, you were talking about the FIT test, which is the fecal immunochemical test. I did one a few years ago. I've just hit my 60th birthday, and people now in their 50s are going to get one of these through the post. Just tell us how this works, how the screening works.
So it works that anyone now in this region, anyone over the age of 54, as they turn 54, and then every 2 years will get the test kit through the post. As long as you're registered with the GP, have a home address in England, then you will be part of the National Bowel Cancer Screening Programme. That we were, until a couple of years ago, seeing people 60 to 74. But as we know from Becks' story, younger people are affected by bowel cancer. So the age is gradually reducing. Within the next couple of years, we should be down to 50.
So this comes through the post.
It does.
What do we get in our surprise package?
So in your little package that will come on or around your birthday, so your birthday treat will be...
Thank you. I'll wait for mine to arrive. Yeah.
A little box with a small plastic tube in that just has a little applicator to just stick into your poo and send back. There's a little instructions are printed on the box so that nobody loses the instructions, because as you open it, the instructions are there, and there's a discreet envelope to send it back free post to the Bowel Screening Hub in Nottingham, which is where they're all processed.
It's easy. Yeah. Don't file it with all the other paperwork.
Well, we have Elizabeth, one of our volunteers, and she's very happy for me to repeat her story. She's one of our volunteers, and she received the kit and she threw it into the drawer. And 18 months later, she had some horrific surgery. She's through the other side now, thankfully. But she just says, if only I'd have done that poo test, who knows, it could have been sorted much earlier and less invasive as well. People are frightened, aren't they? But try and get over that fear and do it, because it takes seconds to do, and it could save your life, isn't it?
It could. We call it a life-saving poo stick. Love that.
Yeah.
We all poo, just stick a stick in it. And
stick a stick in it. Yeah. Stick a stick in it. We are seeing, though, some amazing treatments, as you said, and survival rates are getting better.
They are very good, yes. That's not my forte, because I'm part of the screening, so I'm at the beginning of the process. But things change all the time.
Does it frustrate you, just going back to the screen, does it frustrate you that people don't do these tests? I mean, overall, I think the figure's about 25% of people in Suffolk don't go for their screening appointments, and I think it's getting worse, isn't it? So does that frustrate you? Because it's so easy to do these things, isn't it?
It is very easy, and it's offered to you. The screening programme's there for everyone to participate in, whether it's your bowel screening, your breast screening, your aortic aneurysm screening. All of these things are there for people to take part in. They're offered to you free.
Yeah, and could save your life.
They could.
Yeah.
That's the most important thing.
Final word from you, Becks?
Check your poo.
Simple as that?
Simple as that, yeah.
Yeah.
Check your poo, trust your gut, know your own body, and if you are worried about anything, talk to someone. Friend, family, GP, anyone.
And the more we talk about it, the better.
The more we talk about it, the better it will be. And although I think we both had challenges with our initial diagnosis, I couldn't fault the care I received at that point of emergency. Like I say, my surgeon, Dr. Arshad Malik, was phenomenal. He's at the top of his game in his field. We're so lucky to have him here in Ipswich in that kind of capacity. I was hugely supported, particularly by Charlie Durrant, the oncologist as well. She was phenomenal, and I keep in touch with Charlie a lot, and she's talking about how massively different the changes are in the immunotherapy and the kind of more personalised treatment that if I was presented to her today would have been to what I received 5 years ago. So there's so much progression, there's so much going on, but the earlier you can get the diagnosis, the better your chances are, and that's massively important.
Terry?
I'd just be persistent, Mark. If you know something's wrong, then be persistent and make sure that the system takes you seriously and doesn't send you home with a wrong diagnosis of something much less threatening, like as I was, piles, because I kind of fitted the profile. If I'd taken that diagnosis and left it for 3 months, 6 months, whatever, well, I may not be here now. So be persistent.
Julie, what would your advice be to people listening?
Don't sit on your symptoms, really. If something's worrying you, then be checked out. If the bleeding from your bottom turns out to be piles, then fine. But if it isn't, then you've done something about it.
Yeah, we must say that, probably more often than not, some of the things that we go to the GP about aren't going to be serious. They're going to be something, and then you can stop worrying, can't you? Yeah, it's dealt with,
Exactly.
So just go and get those symptoms sorted out. Well, look, thank you all very much for joining us on the podcast this week. Special thanks to Julie Steadman, lead specialist screening practitioner with ESNEF's bowel screening programme, working at both Ipswich and Colchester hospitals. And Becks and Terry, thank you very much for being so open about your experiences as well, because that's really very powerful to hear people talking about their own experiences with this. So thank you very much for opening up for us today.
Thank you for having
me. Really appreciate it. And Julie,
Thanks
thank you very much. So that's it for this edition of the Cancer Support Suffolk podcast. Thank you very much for listening. If you want more information about what we do, then visit cancersupportsuffolk.co.uk. That's cancersupportsuffolk.co.uk, or call us on 01473 211 884. 01473 211 884. We're based in central Ipswich, and you can always pop in and see us. Cancer Support Suffolk is passionate about educating and supporting the people of Suffolk, and as a registered charity we rely on donations and fundraising to be able to continue our vital work in the community. This podcast is the copyright of Cancer Support Suffolk and is produced and managed by podtalk.co.uk. It's supported by the Suffolk Community Foundation and the Suffolk and North East Essex Integrated Care Board. From all of us at Cancer Support Suffolk, until next month, goodbye.